Clerke, who is an experienced hand therapist based in Brisbane, who has recently come back from doing volunteer work in Ukraine and is going to share with us today a little bit about that. So, Dr. Clerke, can you first tell us a little bit about your professional background and how you came to be a hand therapist?
So I started with a Bachelor of Applied Science in Occupational Therapy. In Australia, that's a 4-year degree. And my very first job as a new graduate was in Victoria's second largest road trauma unit. So right from the beginning, I had a supportive mentor in the lead orthopedic surgeon and became really encouraged to continue down that road. So trauma has always been something that I didn't know I'd be in as a high school kid. I thought I'd go into mental health. Um, but from that very first job on, it was really a passion for me. So then hand therapy seemed to be a really good way to marry in psychological support of people, because any hand injury is devastating to their body image and their career and their function. It combined anatomy, the skill of making orthotic devices, which is always fun, and being really practical with someone. You know, if you can't pull up your pants, that's a big deal. If you can't tie your shoelaces, if you can't feed yourself. So hand therapy seemed to be the merger of all of those. So went off and did a lot more studies. To be a hand therapist in Australia, you need to be either physio or an OT, and then cross-train in the others um, skills. So I learned about electrotherapy, ultrasound, mobilizing, massage, all those things that a physio would know. I went off to get the PhD to help me qualify as an accredited hand therapist and did studies in the area of measuring hand strength, its reliability, and factors that affect it. Um, Went overseas and did 2 years work in Malaysia, developing a rehab centre early in my career, came back and then focused on hand therapy exclusively after a stint in homeless people. So I had quite a background before the narrow specialty of hands, and then ran my own clinic with my husband for 30 years, which we sold, and then we were looking for uh, other avenues to use our skills. So John knew pastor and his wife in Ukraine. That's a very long other story. And they invited us to come over. As I said, soldiers were just being discharged from hospital and just left to their own devices with or without stitches still in place. And I was like, oh, well, I can help with that. I met via Zoom. And they got so excited by my offer, they said, great, when are you coming? We can pick you up. And I was like, oh, hang on. So I sort of got, they were so enthusiastic that I couldn't turn them down. And then when I found out they meant drug and alcohol rehab, I was like, oh, good, I'm safe, I don't have to go. I know nothing about drug and alcohol rehab. And they said, no, but we know the president of the Ukrainian Christian Medical Association. We'll get in contact with him and he'll contact you. And I was like, so that's the really short story of it. So then after meeting up via Zoom with Rudy, and then amazingly enough, he was coming to Brisbane with yourself. So that's how I came to be under CMA's guidance for the trip to Ukraine.
Great.
There you go.
Yeah, wow. And sounds like some really great skills and experience that could be used in Ukraine. And that sort of explains a little bit of how you were motivated to volunteer in Ukraine. But can you tell us what your first impressions were upon arriving in Ukraine and sort of how those realities on the ground compared to your expectations?
I'd had a lot of conversations beforehand with yourself, with Rudy, with Anna Demchuk. She was on Zoom with me a bit. So I was already aware of the possibility that there might be an airstrike in the towns that I would be in, but that you keep your phone by you and you have some warning with the alarm system. So I already knew that there was danger, um, but knew that the southwest wasn't quite so hazardous. I was invited to Dnipro, but there were many reasons I didn't go, and one of them was safety. I thought the city of Dnipro was just a bit too close to the front line. So we got some of their therapists linked in with Recovery Centre, so they were able to come to the talks when they were held in Recovery Centre in Kyiv. So I felt okay about going, and I was a bit nervous. I thought the overnight train was a possible target. It's a long time on a moving target. I didn't know whether the Russians were bombing trains or not, but I slept anyway. Um, so it was fairly similar to what I thought it would be like. It was a bit more organized and a bit less destruction in the major towns. Certainly when we got into Lviv, we didn't see any signs of bombings. When we got to Kyiv, we certainly saw the anti-tank barriers all along the sides of the roads. So it sort of matched up with reality, although some of it was life as normal, and I was told that that would be the case. But then underneath that life is normal was always, but I haven't heard from my son for 3 weeks. Can you pray for him? Or I'm afraid my husband's going to be called up. Or very early on in our time in Kyiv, we saw uh, men just being surrounded by 3 guys in uniform with machine guns and 2 police, and then they would be escorting him off to the military office if he was of serving age and wasn't already serving. So the everyday sadness you could see quite quickly. So yeah, it was what we thought in many ways.
Yeah, sounds tough. So, could you walk us through some of the work that you did in Ukraine with CMA and with the local therapists, and sort of what kind of injuries and cases you were seeing?
So I was asked to visit 4 different cities, repeat a week's worth of lectures to 6 different groups. So I did some preliminary work trying to find out the level of knowledge of the therapists, particularly because occupational therapies only started in Ukraine in 2019. Then the whole world had COVID. So I knew before I went, most of them were new grads. And I'd sent over some survey monkey questionnaires to ascertain their level of knowledge of really practical things, because I wanted to teach them the things you can't teach on Zoom. So, how to massage, how to mobilize, how to make an orthosis. They're the things that you can see a video with, but there's nothing like actually practicing and someone saying, that's too tight, that's too loose, that will be uncomfortable. What's your rationale behind that? Um, so the Survey Monkey questionnaires to start with are really helpful in letting me know what to teach. So the pattern was Mondays I'd be shown around the hospital. I'd have a look at what equipment they had that I could use to teach with, because I wanted to teach swelling control to help with wound care and pain and stiffness and all those things. So often on the Mondays, I would have already sent them a list of, if you've got plaster Paris, this is what I'll teach. If you've got Coban, this is what I'll teach. If you've got this is what I'll teach. And had 4 days worth of lectures ready to be adjusted. Mondays I get there, and often the hospitals would say, well, we couldn't get 95% of what was on your list. And so very soon I learnt to ask John to be my procurement officer. So he'd go along to the epicenters, their Ukrainian equivalent of Bunnings, beauty stores for what they could offer, vet stores for their equivalent of Coban, and he'd gather all these things for me so that we could run a course on wound care, when to mobilise fractures. Very early on, they all wanted a lot of information on splinting for neurological patients. So just trying to source Velcro for them. The Mondays were spent assessing what they had, working at what I could teach with what they had, making sure that what I thought they wanted to hear, they did. And then we'd lecture from Tuesday to Friday in the mornings. And in the afternoons, they'd gather patients for me to do some splints on or do some scar massage or whatever techniques we taught that day to help consolidate it, and they'd practice on each other. So that was a pattern for each week.
So it sounds like it was really important to be able to be flexible and adaptable and do a little bit of MacGyvering. So
Oh, yes. Yeah. Some of the photos I sent back to girlfriends here were very funny because it was felt instead of leather, and had elastic. And yeah.
oh,
But
great.
stationery stores were my best friend, and the epicenters were also good.
All right. Well, that's some good tips for people thinking about going. And
Yes.
you you mentioned that a lot of the people you were working with were probably new grads, because it's a fairly new specialty. Did Was there anything in particular that stood out to you though about the people that you were working with the young therapists and the teams?
Um, but they're amazing for even still being there. Most of them were young women. Um, by the fourth week, word must have gotten around, and we had a lot of rehabilitation doctors and surgeons and neurologists attending as well. So that was really encouraging to see therapists and doctors together, because one of the big standout messages was the young therapists were, if you remember being a new grad, you're super confident and you're totally unconfident, both at the same time. You know everything, but you really know nothing. And you keep that in your head. And so you don't ask anyone anything because you're supposed to know it all, but you don't. Um, and that's how I felt. And they would focus in on a part of a problem rather than seeing that as a whole with a person. And that's just something that comes with practice and maturity and following people along and getting to know them as a person rather than a condition, um, and getting them more confident in approaching the surgeons or the doctors to say, but why is his elbow stiff? So I'd come to me and go, can you make a splint because he's got a stiff elbow? And I'd be saying, well, why is the elbow stiff? Let's look at the x-ray. And they'd say, oh, no, we don't look at x-rays. Um, Sadly, it doesn't take a lot of skill to see what I used to see on x-rays over there. You know, if an elbow was shattered, then you had to talk to them about, okay, this is not going to ever move normally. What are we going to achieve? And then help them with some informed decision making. So there's quite a lot of that went on, just encouraging them to think it through, see the person as a whole, talk to the surgeons. Sometimes that was not possible because the scenario I saw so often was a soldier or a civilian would be injured on one of the frontline in one frontline towns, go to a stabilisation centre, have an amputation or sewn up, whatever could be sewn up. With soldiers, they'd then go to a military hospital for a very short amount of time because it's not safe to have a lot of trained people in the one spot, and then off to all the regional hospitals. So by the time they got to a regional hospital, it was really difficult for those therapists to get in contact with the original surgeon.
Yeah.
And he'd be doing 15-hour days, so he didn't have time to write beautiful, lovely reports. And what he did write didn't necessarily go with the patient. Um, so it was good working with therapists saying, you need to find out this information. If you can't, you need to ask the doctors to request an x-ray now, or you need to ask the doctors about this, or if we're going to rehab his nerve, we need to know whether it was repaired, compressed, or severed and never repaired. And so they got to see the whole picture more. And that was really rewarding for me, and I think helpful for them, because if you're working in the dark, you can't have any decent job satisfaction. You can't inspire your patients.
Sounds like what was really valuable in terms of your experience and what you were able to contribute was not so much the technical skills, although there was obviously lots of those, but those systems issues and approaches and what we in general practice call soft skills, how you communicate with people, with your colleagues, with patients. So yeah, stuff that's often much more valuable and harder to teach than the technical skills. So yeah, that's great. So you mentioned a little bit about the process of the people going through the patients going through the different stages and stabilization points. So the ones that you were getting to see, like what were the most sort of common injuries that you saw or problems that you saw?
I was mainly at the neurophysiological hospitals. So people with head injuries and hypertonia, walking problems, speech problems. It was always very sad. They always were complex in their injuries, which is challenging for anyone, let alone someone that's only been out a year or two. And the rehab physicians, they also seemed quite young in their knowledge as well. So everyone was being a huge amount of complex people. So I'd see someone that had awful bed sores and half a face that was 3 centimetres higher than the other half, with one hand contracted with only one hand to use. And they'd say, can you make a splint for him? So then we'd have a whole discussion about pressure care and communication. And well, why is he biting? Can he see when you approach from that side and you hold his arm? Some of the patients I saw were upper limb amputees at various levels. So that a lot of them had a lot of scar pain because often the nerves weren't sufficiently redirected. Um, the targeted muscle reinnervation is not known to all of the surgeons that are doing the amputations. So a lot of scar care work for these fellows with their complex injuries.
Yeah, sounds terrible. So, in amongst all of that, can you think of perhaps a specific story or moment that for you illustrated the impact of the work that you and CMA were doing in Ukraine?
Probably the CMA interpreters. They were typically just finished final year medicine on summer break, about to start residency. And the highlight for me was they would come and they'd go, "Oh, well, I'm going to do the topics on Tuesday. Can you send me the PowerPoint? What's Tuesday's topic?" I said, "Oh, it's fracture healing and mobilization timelines." And they go, "Oh, great. What are you doing Wednesday?" "Well, Wednesday we're going to talk about edema control." "Oh, can I come Wednesday as well?" And I'm like, "You don't need to because the others are coming." And they're like, "No, no, no, we really want to come." And that for me was, these are young, inspiring people that are working as volunteers, not paid. Some of them would have to go to a different town to meet me because I was traveling around the countryside, pay for their own accommodation and volunteer to interpret, and then interpret on days they didn't need to. So they would be the highlight. And they'd be in there making splints and batting Coban around people and teaching diaphragmatic breathing. And I thought, it's so good that they want to learn. And this is not things they get to hear about in medicine. So they'd be my highlight, all of those lovely young people.
That's wonderful. And that's terrific feedback for you. I guess, like, was there any other sort of specific feedback you got perhaps from the therapists, like anything that people sort of said to you about, your work and you coming over to teach them?
The therapists all said it was really good and inspiring. Certainly some of them were very keen to keep me there for a very long time. They said, "We just keep you here, you don't have to move on." They were very tech savvy, as listeners may or may not know. But, sorry, got distractions here. The feedback that they gave, they would be joining everyone that could go and couldn't go onto the WhatsApp group or Telegram group. And so there was lovely comments put on the Telegram group about, "That was really interesting and that was amazing and we've never heard something like that before." The neurologists gave feedback that I explained things in a way they'd not had explained before. I don't think I'm a great lecturer. I'm a clinician. So for it to be explained by me so that they thought it was clear and logical, and therefore this is why we do this therapy, was really reassuring to me that I'm on the right track. So there's lots of that feedback, because I'd often also stop in the middle of a talk saying, "Now the next talk's this. Do you want to hear about that, or do you already know that? And if you already know that, just tell me to move on." Um, and rarely they did. Sometimes they'd say, "Yes, yes, we already do that here, but we want to know how you do it in Australia." So it was good to get that sort of feedback, that they knew plenty and that I respected that they knew plenty. So it was good and honest feedback from both sides often.
So, how did CMA Ukraine play a role in facilitating your visit, and how critical was their role in making this work possible?
They certainly gave me the official documents to say that I was invited in if I was to be stopped at the border or stopped at one of the hundreds of checkpoints that you come across as you travel around. Also, they did all the approaching to all the hospitals to say, "Here's this therapist, she's got these skills." And they linked me up to have a big Zoom session with all the heads of departments of all the hospitals I could visit to say, "Well, what can you contribute?" So this liaisoning work was vital. I couldn't have just wandered into Ukraine and just arrived at hospital and said, "Hello, I'm here. Like, I think I can teach you." Blah blah. Um, and a Dem truck was fantastic. Any problem I had, like my SIM cards run out of credit, or I don't know where to get the train, she would be straight onto the communication. Um, she booked all the accommodation for us near the hospitals. I couldn't have done that without her because I look at a map and think, well, I don't know. So everything was within public transport or a short Bolt or Uber. Yeah. So she was invaluable. I could not have done the trip without her.
So, I'm not sure how much of sort of CMA's other work you got to see with, the medical system over there. But with your observations, what do you think sets them apart in terms of their approach to supporting medical professionals and medical aid and just the health system in Ukraine?
I only spent 3 hours in Lviv, so I didn't really get to see what they do on the ground. I had a bit of a debrief with Rudy then. That was about my fourth or fifth week into it. So I didn't see physically any pressure mattresses with CMA labels on them or anything like that. And I wasn't working with any of the doctors that they sponsored over. There were some Taiwanese doctors in different cities when I was in other ones. So direct work, I can't give specific feedback. I'm sorry, except to say that Anna was incredible at that level. I couldn't have done it without her.
Right. So, what about personally? What did you take away from this experience?
Ooh, I'm always very aware of what a blessed life we have here in Australia. And going over there and seeing the fatigue and hearing the air alarms, um, and then continuing to send messages to and fro them personally keeps me reminded of the fact that it's a very unpredictable life. Um, and just my admiration for them just goes up every day when I hear more bombings, but they still stay and they still try and work. And um, I'm still doing Zoom sessions in with them just to try to let them know they're not forgotten. Um, and they're a little bit surprised that Australians care so much because I've got lecturers on cognitive rehab giving lectures. I've got orthopedic surgeons giving lectures. I've got a surgeon specialises in amputations giving really specific, detailed surgeon level information. And the Ukrainians are feeling supported. I'm sure they're not feeling great when they're sitting in a bomb shelter. So I am hearing the drones flying overhead. Um,
Yeah.
so yeah, for me personally, it's really important to keep supporting them.
Yeah, so that's a great message, and I guess further to that, what is there anything else that you would say to people who might be thinking about supporting CMA or CMA through only passing through, whether it's financially or through things like you mentioned, like helping with lectures or um, you know actually going over and doing trips like you've done? Like, what would you say to people who might be potentially thinking about supporting?
If people want to go, it means a huge amount to them. A huge amount. They're all quite funny. They'd say, "Oh, yeah, where are you from?" It's Australia. And they go, "You're so brave for living in Australia." And I'd be like, "No, you're so brave for staying in Ukraine." And they go, "Yeah, but you've got spiders." There's this big thing about spiders, and I don't mind the crocs and the snakes. Spiders. Oh, so being there was great for them to know that all across the other side of the world, we are aware. Um, Donating money is a huge deal. Like they have minimal supplies in the hospitals. They don't have appropriate dressings. They have horrendous pressure sores for a multitude of reasons, and one is just lack of pressure cushions. There's no sewing machines to sew up burns garments in the hospitals. There's no Koban. At one stage, I got a bit annoyed was why is there so few bits of equipment? So there was no rubber bands in one hospital. I was like, well, I'll go buy a packet. And therapists say, oh, well, we give the bands to this patient for 5 minutes hand exercise. Then we give it to the next patient, then the next. You think,
Mm,
really, you can't afford basic equipment?
mm,
And asking the head of that department, what's the budget for patient consumable? He said, there isn't one.
mm,
So you just think of, if you've ever been to a therapist, you get therapy or you get a compression sleeve or you get a splint.
mm.
There might be a bunch of splints, but they don't necessarily get to the patient because there's a lot of processes that go on. Um, so certainly money is needed, and money that's really specifically directed to a department or a person to spend. Providence was good. You know, they'll send photos of the sewing machine you've bought to sew pressure garments or whatever it is people want to donate money to.
Yeah.
One awful story I heard that um, is on my list of things to help with. Talking to one of the surgeons from a military hospital about bone grafts. He was having a conversation via Zoom with one of our orthopods. And the orthopod here said, "Oh, and so to use the Acumed bone harvesters." And he said, yeah, I learned how to use that when I was in Germany. I've just got hammer and chisel here to get bone grafts. I
Wow.
thought, how much extra trauma are you causing this poor person with that way to get bone for a graft? Not having bone harvesters, I was like, oh, you know, we need to raise money for bone harvesters. You know, get the ones that the surgeons have already used elsewhere and know how to use and will use.
Mm,
So there's plenty of money for plenty of really specific things that we can get to specific people that know how to use them.
yeah. That's one thing that I was impressed with when I did get to spend a bit of time with CMA in Lviv and their warehouse and have a look at what they do there. And they get a lot of donations of physical goods, so truckloads of equipment and often quite highly specialized equipment, from the NHS and Sweden and so
Hmm.
forth.
Mm.
Um, but often, as you say, things needs are often very specific, and it's no good just dumping a whole bunch of stuff in a place and then people don't need it or want it, or the stuff
Mm.
they do need is not there. But that's
Mm.
a big part of what they do in their warehouse, is everything gets sorted and catalogued, and people can put in requests, and they make sure that people only get what they want, what they need, what they're going to use, and people can ask for things. So if they have a specific need for an anesthetic machine, they can ask CMA will look at their inventory and go, yep, we have two of those you can have, and then ship it to them. So yeah, so that's really good too.
At the time of being there and talking to Rudy, he said that they were struggling to pay the rent on the warehouse.
Yeah.
So it's great that people donate things, but they forget it's got to get shipped and it's got to get stored.
Mm.
And those unattractive costs are there all the time.
And that's a really great point, because that's a lot of what we tried to do, and only passing through is focus on raising funds for those things. And we tell people who give money to us that people are donating truckloads of medical aid, but they haven't got, like you said, money to store it or to pay the fuel for the truck that delivers it. And that's the stuff that people sort of don't want to get a, a photo of the truck that they put fuel into. They want to get a photo of the cute little kid getting something. But
Mm.
it's equally as important. Yeah, absolutely.
Yeah.
So what about you? What's next for you? Do you have any plans to continue working or collaborating with the CMA or the therapists that you met, or any of the contacts you've made in Ukraine into the future?
Yes. So I'm still doing Zoom sessions from here. One of the med student interpreters from, I can probably name the hospital, from Farafania, ended up getting a job there with the therapist I trained. So he did interpreting and now he's working with them. He's a really lovely young man. And so he's been very keen on continuing the training. So Tuesday, there was a talk on cognitive rehab. Tomorrow night, there's a talk on uh, different simple modalities you can use to help with scars and wound healing. So I'll continue to do that as they say, look, we really want information about Pusher syndrome, all this or that. I will go and find an expert from here, persuade them to make a PowerPoint and commit to a time to do a Zoom sessions, so I'm still networking, liaising in. Whether I go back, it all depends on what happens over the next few months in Ukraine. If I go back, it would be probably May next year. But with the situation the way it is now, no one knows what's going to happen. I would like to think there was enough stability in some of these towns for me to go, but I'm open either way. But I'm supporting them here. We found some seamstresses. We're going to look at getting some money raised for some sewing machines to try to upskill the therapists in being able to make all sorts of things to help patients.
That's wonderful. So, I mean, it sounds like what you're doing, continuing to do, is really, really important and helpful. And if there's anybody who listens to this who works in this sphere and wants to assist you or do one of these sessions for you or help you with something, are you okay if they get in touch with you?
Yes, I'd love them to get in touch. We're really light on for people in the area of head injuries, concussion syndrome, all those sorts of things, because Ukrainians are really keen to learn. A lot of their lectures, they said, was from the older doctors who sometimes are not necessarily up with some of the newer things that are now evidence-based from the West. So it's really great. And we get a lot of people zooming into these sessions from all over the country. And my interpreter / now doctor is also great at networking. So we're getting an audience of people that want to hear ideas about really specific topics. So if people have got an area of expertise that they think may be of use, then I'd love to hear from them, and we'll match up a time and a place and get something happening.
Fantastic. That sounds great. So we'll try and get that message out. So thank you so much, Dr. Clerke, for your time, and thank you so much for what you've done and what you continue to do. As you say, it's so important. I know myself that this kind of support means a lot to people who are going through so much at the moment. So it's greatly appreciated. Before we wrap up, is there anything else that you want to say or finish up with?
Probably just that since coming back, lots of people have had lots of questions here, and they're showing love and concern. It's so nice that Australians are aware and interested and wanting to support Ukraine, even just support by having better understanding about what is actually going on and why it's going on. Yeah.
That's great. Well, keep up the great work, and thank you so much for your time.
You're welcome. Thank you.